Hello everyone. Thank you so much for focusing on overdose prevention, because every single one who died, they had the potential for a great and dignified life until the very last heartbeat. And it is often portrayed as if overdose deaths means less than when others lose their lives too early. But we are not just as valuable as everyone else. Relatives are also often left with an unusual, deep and complicated grief after the countless dilemmas they have faced in the years before, often heavily influenced by others' input based on stigma and prejudice. So preventing overdoses is among our society's biggest tasks, and every overdose death can be prevented. And so I want to thank the Scottish Drugs Forum for inviting me. It makes me feel proud because once I lived in the streets of Oslo as an injecting drug user, now I'm leader of an organization. I have survived several overdoses, and I now stand here before you at this important conference. And I am proud to say that I'm a drug user because I have nothing to be ashamed about. And if you have never used drugs, you must think, why? Why on earth? All the risk you put yourself into, all the things you've done in your life, and you never used a drug? Well, maybe you should reconsider. Maybe you should think once again, and it's never too late. The reason why I'm so proud is because I did not obey unjust laws. In all big histories, with the biggest heroes in all great parts of our history, are those that did not obey unjust laws. And the drug laws are not, they are both very unjust, and they are based on a racist and colonization ideology, and they disproportionately target people of color, people with low social status, and indigenous people all around the world. And I'm also very proud of the drug policy development that is going on in Norway and the reason behind it. We are in the midst of a drug policy reform. And I will return to what that is all about, but the most important thing is that it is grounded on the basics of harm reduction. Norway is a country with the same population size as you, and we have more than 50 sites with needle and syringe exchanges. We have had drug consumption room for since 2005, so it works so well. Now we have 3, we will get 4, we give it 5, because it really saves lives. And we have a national substitution treatment with 8,000 persons in receiving mainly methadone and buprenorphine. 2 days ago, I learned that now we will also get short-acting morphine and long-acting morphine to reduce the gaps, to reach out to many more thousand people that can need substitution treatment. And since 2004, those who need any kind of drug treatment, they have patient rights. And the beginning of the harm reduction in the late 1980s was the first real turning point in drug policy. Even though we were in the harshest, most aggressive period of the war on drugs, the HIV epidemic brought a desire for evidence on what works and what doesn't. This was the first time that we broke through the intolerant abstinence-only approach. And since then, the harm reduction services have increased and developed and is now a key element in the ongoing development in drug policy. So now I want you to try to imagine the ideology, the attitudes, the opinions, and the perspectives that the politicians, researchers, and professionals had at that time. And then I want you to try to imagine who came up with all these new ideas, the suggestions of what could be done to prevent HIV. I mean, handing out needles and syringes so that people could inject the drugs with them, it was unthinkable for the professionals, and it was unthinkable for the researchers, and it was unthinkable for the politicians. Even that drug users could care about their own health and others' health, or in any way be valuable resources, it was simply unthinkable. And it was unthinkable that it was necessary to have a room for consuming drugs in a safe environment with good hygiene, with closeness to health workers, and without fear for being criminalized, and without any fear to die. And I mean, prescribing methadone and buprenorphine, formerly known as illicit drugs, drugs that the authorities fought against, it was unthinkable. It was the drug users who suggested this. It was us. And eventually the politicians took us seriously and listened to us. Drug use was still criminalized, but since then, the health-centered approach and the tolerance and the pragmatism has grown, and several drug user organizations have been established. The first drug users organization in Norway were run by the temperance movement. And to participate, one had to be a former drug user with a turning point history related to when they succeeded in drug treatment, when they stopped using drugs. But eventually, we others could also establish drug user organizations, and we saw early on that the politics was now contradictory. On one hand, we help and include, and on the other, we punish and exclude. The health-centered approach brings evidence to what works and what doesn't. The organization I represent, the Association for Humane Drug Policy, is a drug user organization with active drug users, former drug users, some in substitution treatment, and some without. We were established in 2006 as a result of the ongoing debates about harm reduction and the need for drug users' perspective. We had to organize because we stood up against big organizations and, at that time, most of the politicians. We are promoting harm reduction, substitution treatment, and we are opposing criminalization and brutal police actions against the drug scenes. We also fight for legal regulation of drugs because we want the state to take control. When a drug is prohibited, they call it a controlled substance. Go out in the streets and you'll find it immediately because there's no control. We have a high media profile and we meet our opponents with the utmost respect. And since 2008, we have paved the way to be invited into the parliament every year, together with active drug users. And that is now an annual tradition that we call Drug Users Day. And some of the authorities wanted us to be just a patient organization and only participate in the healthcare system, while organizations from the temperance movement could work on the political level and represent Norway internationally. But nothing about us without us. We also are a political force. We're not criminals because we use drugs, and we're not patients because we use drugs. First of all, we are citizens. We deserve not only patient rights, but also human rights, to be treated as equal. 10 years ago, we suggested new overdose prevention measures, which was to hand out naloxone and to have a switch campaign, where we inspire heroin users to switch from injecting to smoking. And we prevailed again, and this is now the key elements in a national, in the Norwegian Parliament's national overdose strategy. And again, these measures, it was unthinkable for the others. The use of naloxone and maybe especially the switch campaign, it brought a change in attitudes, more tolerance and more pragmatism. And a bunch of new municipalities starting up harm reduction services. So in 2016, we, the Association for Humane Drug Policy, we wrote a petition together with some other drug user organizations in Norway's biggest newspaper, and it was signed by 90 public figures, academics, politicians, party leaders, and lawyers. And there we demanded to be listened to, that human rights must form the basis of all drug policies, and that the use and possession of drugs for one's own use must be decriminalized without being replaced by new and intrusive sanctions. The then Minister of Health, in a conservative government, has since stated that this was a turning point for him. In 2017, it became clear that a majority of the representatives in Parliament supported a move from justice to health. And in 2018, the government formed a drug reform committee to look at the findings from all countries. And the drug reform committee did extensive research for a year, and in 2019, the committee suggested a model for decriminalization of drug use. And their findings confirmed our view. Criminalization of drug use does not prevent drug use. It only creates stigma, marginalization, and it creates crime, and it creates most of the elements in what we call drug problems. Criminalization is actively counterproductive. Very few of those with drug-related problems seek help because of the stigma. An individual with drug-related problems doesn't find the health-related approach very interesting as long as he or she are treated as a criminal being. And as long as we are criminalized, the health-centered approach is also very small, narrowed, and moralistic, because it creates an attitude that one must not go too far in helping those who the overall politics is to punish. In March 2020, the Minister of Health, Bent Høie, held a side event at the Commission on Narcotic Drugs in the UN building in Vienna about the findings and the suggestion for a drug policy reform with decriminalization. At this meeting, with representatives from all over the world, ambassadors, politicians, bureaucrats, I thank the Minister of Health for including the drug user representatives in the work for more evidence-based and human rights-based politics. And then, at this moment, with all these people around, in the lion's den, then Bent Høie replied, "Thank you, Arild. We have been discussing this for more than 20 years and had our disagreements. You were right and I was wrong." The proposal from Norway was very well received by representatives from the World Health Organization, the Office of the High Commissioner for Human Rights, UNODC, and several other high-level organizations. In short, they received this as best practice within and fully consistent with the conventions. And they said, look to Norway. And when the government was ready with their proposal the year after, in 21, the Minister of Health wrote to me in a hard copy of the government proposal, "Dear Arild, this is Lex Knutsen," and that means the Knutsen's law. In that, the Minister of Health, Bent Høie, again showed this remarkable acceptance for the drug user organizations. And the Parliament was still not ready for it, so they turned the minority government suggestion down. But the majority of the Parliament supported a move from justice to health, and they thought that they should replace punishment with offering treatment for persons with severe drug dependence, but they opposed decriminalization as such, because they still thought that one should maintain the criminal responsibility for young experimenting drug users and adult recreational users. In my view, that is a political abdication of responsibility. But even though the discussion is still going strong, and there has happened so much in the aftermath of this that it is really amazing. When the big debate about decriminalization started, people's eyes were opened. Different parts of society began to evaluate itself. It gave birth to rethinking what had been considered as right and wrong for decades. So now we are experiencing structural and cultural changes in attitudes and practices that are even greater than a change in law could bring. We now have 2 clinics with heroin-assisted treatment for more than 70 people, and also we are in the midst of a groundbreaking development of the substitution treatment, where we have tryouts with substitution medication also for other serious addictions with benzodiazepines and central stimulants. And guess who suggested that? Last year, the National Institute for Human Rights published a report about drug use and human rights, and they point out stigma as a central issue, and they point towards efforts that can be done to secure human rights for people who use drugs and to end the wrongs that have been done because of stigmatizing attitudes. Since 2021, the police have been forced by the Attorney General to change the way they treat people upon arrest, after for years using integrity-infringing measures that really was not allowed. And the court system has started reducing penalties in drug cases since 2021, in some cases even changing certain sentences from months in prison to a few weeks suspended sentence. And within the court system, it has also been expressed that punishment for drug use is pointless. In April last year, the Supreme Court finally decided that those with substance use disorder shall no longer receive punishment for their own personal use. In one child case, even a recreational user was let off with probation for 10 grams of amphetamine in his car due to personal circumstances. So I must say that the Norwegian society has really started taking consideration to the well-being of the people to whom this applies, rather than blindly punishing them for the sake of moralism in the society. The Attorney General has since instructed the police that if a person is suspected to be in possession of drugs for their own use, is addicted to drugs, this person should no longer be stopped, searched, or arrested. And if the police are in doubt as to whether the person is addicted to drugs, then the benefit of the doubt must be given to that person. And there has been a historic drop in reported drug offenses after this, and the development shows that what we now deserve is an extensive research on whether the police should prioritize use of illegal drugs at all. Because since the police have taken 2 steps back, it has opened for social workers to take 2 steps forward. They have the right expertise, they have the right tools, and then the police can prioritize serious crime, even such crime that traumatizes people and creates the kind of trouble that a lot of people use drugs to be able to bear with. It is also time to acknowledge that drug users have a particular vulnerability to being exposed to crime, and that they must be protected. The police should change their practice from criminalization to behavior regulation, and they should join the efforts for more harm reduction. They should ensure that drug users are just as protected from crime as anyone else. We want drug users to have the same protection of the law that everyone else can take for granted. A few months ago, a local police officer said to me, "You know, I think there are other professions that can do drug prevention much better than us in the police," and I think he's very right. When we look into what the authorities have taken into account and what the discussion mainly is about the follow-up after arrest. Well, why on earth arrest a person because of drug use at all? So what we are suggesting is a concrete discussion about police work and priorities in all stories about oppression and human rights violation throughout history. Police control instead of police protection is at the center of these stories. So to conclude, the inclusion of the drug users' perspectives and the focusing on overdose prevention has resulted in such changes in attitudes and practices that we are actually changing a whole society, a whole population, eventually the whole world to the better. We are among the most valuable resources, and we deserve to live.